Excessive sweating is common. It affects around 5% of population. Sweating itself is normal. It is a way our body regulates temperature. When you are hot, physically active, stressed, or in warm environment, sweating is expected. But when you are sweating in cool room or while sitting or at rest with minimal activity, it's no longer normal temperature control. At this point, the sweating is considered excessive. Medically, this condition is called hyperhidrosis. When sweating is chronic and starts at young age, usually it is primary hyperhidrosis. This is not sweating because you are hot, it happens because of overactive sympathetic cholinergic signaling to the sweat glands. Typically, the sweating is focal, meaning it affects specific areas, palms, soles, and armpits, and sometimes face. It is usually bilateral. It means that occurs in both sides equally and starts at a young age and stops during sleep, which is important clinical clue. For diagnosis, symptoms should last at least 6 months and this should be clearly visible sweating that is excessive for the situation. Treatment depends on severity, but the most effective and first-line treatment is aluminum chloride antiperspirant. It is usually applied at night, left on 6 to 8 hours, and then washed off in the morning. Typically used daily for 7 consecutive nights. And after that, maintenance schedule 1 or 2 times per week. The second important treatment is botulinum toxin injection. It is highly effective, especially for armpits, but it's painful and requires multiple small injections. And the effect is temporary. It lasts for several months and repeat injections are required. Another method of treatment is iontoporesis. It is especially effective for palms and soles. This method is low voltage electric current that disrupts sweat glands transport mechanism. It improves sweating about 85% of cases. It is less practical for armpit. Also, there is topical anticholinergic medications like wipes and creams, and also oral anticholinergic medications which are rarely used, such as oxybutynin. And the last option is surgery. Surgery is last resort treatment. The second most common cause of excessive sweating is hyperhidrosis in women in menopause or near menopause. Typically, this sweating is episodic. It means that it comes as attacks, abrupt waves of heat that are not related to the room temperature. It is very common in women. About 80% of perimenopausal women report hot flashes and sweating. Symptoms last around 7 to 9 years. 1/3 of women continues to have symptoms for more than 10 years. It is related with estrogen level drop, which causes narrowing of thermoneutral zone in the hypothalamus. That's why even tiny changes in body core temperature triggers vasodilation and sweating. Treatment in this case can be estrogen therapy. Estrogen therapy is effective, but it has its own risks. For example, some cancer risks. Also, in some cases, antidepressants are used, but problem is that sometimes antidepressant itself causes night sweats and sweating. And gabapentin sometimes are used, and clonidine in rare cases, but it is rarely used. The third most common cause of excessive sweating is antidepressant. They usually increase serotonin and norepinephrine activity in the brain, and it increases vasodilation and sweating in the body, even when environment is not objectively hot. So body behaves if need to cool down without real temperature trigger. The main solution in this case is that dose reduction or switching to alternative medication that causes less sweating if clinically possible. For local symptoms, especially axillary sweating, aluminum chloride can be used, antiperspirants that can be supportive treatment. The fourth most common cause of excessive sweating is anxiety and panic attacks. They trigger fight-to-flight reaction, and it causes episodic surge of fear and palpitations and heart racing and tremors and sweating and shortness of breath and chest tightness. There's no fever. It is sweating is episodic, not constant, closely linked to anxiety spikes or panic attacks. In this case, treatment is cognitive behavioral therapy or sometimes medications like antidepressants. And fifth most common cause of excessive sweating is infection with fever, usually. For example, upper respiratory tract infections. Night sweats also are common. Fever, chills, profuse sweating often appear in cycles. So sweating is not random. It is part of normal fever physiology. And treatment here is simple and supportive. Treat common cold and flu, maintain good hydration, rest, and control fever if needed. Another common cause of excessive sweating is hypoglycemia. Most often it's related to diabetes treatment. People treated with insulin or sulfonylureas commonly experience sweating during hypoglycemic episodes, and usually it is in the night. It can happen after skipping a meal, after exercise, after alcohol intake, nocturnal hypoglycemia that can present as night sweat, sometimes vivid dreams or morning fatigue. Treatment at this case is glucose correction. Standard recommendation is 15 grams of fast-acting carbohydrates such as glucose tablets, fruit juice, or regular sugary drinks, followed by reassessment and repeat dosing if needed. And seventh most common cause of sweating is hyperthyroidism, especially Graves' disease, which is more common in women. It is when excessive thyroid hormone is released and it increases basal metabolic rate and it increases heat production and adrenergic sensitivity, and person has intolerance of warmth leading to persistent sweating, even normal cool environment. Typical associated with heat intolerance, warm and moist skin, palpitations, tremor, weight loss, anxiety, and fatigue. For rapid symptom relief, beta blockers are common like propranolol. Try to reduce sweating, palpitations, tremor, and adrenergic tone. To treat disease itself, antithyroid medications are used, such as metabolism. And 8, less common but very crucial cause of excessive sweating is cancer-related sweating, especially for lymphoma or other some chronic inflammatory diseases. It is important because it can be life-threatening diagnosis. When patient has unexplained drenching night sweats, malignancy is uncommon, but it must always be excluded. The mechanism is that chronic inflammation causes increased pro-inflammatory cytokines, interleukin-1 and tumor necrosis factor, and they reset hypothalamic temperature regulation and leading to persistent or recurrent night sweats. It's not episodic, it's not flushing type, not heat triggered like menopausal sweating. Instead, it is drenching night sweats, sweating that soaks bed sheets and clothing and occurs during sleep. That is distinctive. Also, there's other red flags you should pay attention, and they are unintentional weight loss, persistent or recurrent fever, profound fatigue, and painless enlarged lymph nodes in the neck, armpit, and groin. There is no single blood test that gives the diagnosis, but when this red flag pattern is suspected, initial evaluation includes complete blood count, inflammatory markers, and a basic metabolic panel. If suspicion persists, imaging and ultimately lymph node biopsy is definitive.